Hey everybody, welcome to Registered Dietitian Nutritionist in your community. And today I have the pleasure of speaking with Deanna Shaffer from one of your local clinical nutrition managers. So Deanna is here today to tell us what a clinical nutrition manager does. So Deanna, I'm going to turn it over to you with that question. What does a clinical nutrition manager do?
Okay, very good. Well, thanks, Kim, for having me. It's really exciting to get to be a part of this and talk more about nutrition in our area and what dietitians do. I've been a clinical nutrition manager for about a year now. Prior to that, did a couple of different leadership roles, including food service and even some data related pieces of the puzzle. So now that I'm in this role, from a clinical side, a big part of my job is to manage our clinical team. Some hospitals in this area are quite large, and so that can add up to quite a lot of staff. So a big part of any manager's job is making sure we have enough staff and making sure they're highly qualified. So I do quite a bit of work related to recruitment, interviewing, making sure that our staff are competent, and giving them the resources that they need to get the job done. In addition to that, I also spend a good amount of time making sure our team is well-versed in evidence-based guidelines. So we spend a lot of time reading research, discussing those guidelines, and making sure that we're practicing those on a regular basis. So we're looking to make sure that our dietitians all practice the same. Our dietitians are able to communicate to patients. So when they're working on maybe a patient that has some issues with their kidneys and they're talking to them about that we're using the most up-to-date and scientific information. And that's a big part of what's different when you work with a dietitian versus maybe just anybody saying, hey, I can help with nutrition, or maybe doing some research on the web. We've studied it a long time, we keep up to date, and we know that the guidance we're giving is going to be the best that you can get. And then finally, we do a lot where we focus on patient safety. So as a manager, I'm doing a lot of auditing, looking at data, reporting safety issues. So if we ever identify those in our hospital, we make sure that we're addressing them. When it comes to being in a hospital, everybody knows there's a lot that can go wrong here. So we spend as much time as we can making sure that things go right, and that you have the safest stay that you can have when you're at our facility.
Awesome. That's really good information to know. So I heard a couple things, Deanna. I heard staffing. I heard making sure that everybody's doing practicing up to date, keeping up to date with the clinical recommendations and the research, which is really a big piece of it, and also maintaining a safe hospital environment from a nutrition standpoint. So that's really good information. I wanted to know if you could give us a little bit more insight onto what a dietitian does in the hospital. If lots of people hopefully haven't been in a hospital, so they may not really know.
Absolutely. Yeah, I think that's one insight that so I'm getting some messages here. Let me see if I can turn this off. So a lot of people don't know really what a dietitian does in the hospital. And I think when a lot of people think of a dietitian, they think, oh, that's someone who's going to tell me what to eat and what not to eat. And in a lot of ways we do that. But when it comes to the hospital, many more of our patients are here because of another reason unrelated to nutrition. And then, let's see if I can turn this off. I'm here at the hospital, so we've always got things going on. It's an exciting place to be. But we often have people come to the hospital for an unrelated reason. And then at the time that they're here, they develop a nutrition issue. So maybe they're just not alert and awake enough to be able to eat. Maybe they have a lot of fatigue or loss of appetite. And so a dietitian's big role in the hospital is to find ways to get that nutrition to a patient who otherwise would not and could develop malnutrition. Malnutrition is one of the most common nutrition issues in a facility where people are here for 3 to 4 days on average. They could end up here for multiple weeks or months. So we have dietitians in our hospital assessing patients for malnutrition, looking to see if they've lost a lot of muscle, maybe they've lost some fat. They're looking to make sure they get enough protein so they can hopefully maintain that muscle throughout their stay and be able to walk out of here when they're healed and ready to go. So some examples of that might be in our ICUs. We have patients that can't eat at all, and so we will figure out how much to feed those patients when they get fed through a tube. That's a really big part of nutrition in a hospital. Some patients can't even get fed normally through their GI tract, and so we have to feed them using an IV. And that's something that RDs really spend a lot of time learning about how to do that well and safely and make sure we get that nutrition in. And it can all be done just through an IV, which is pretty spectacular. We also have patients that get seen on an outpatient basis. So patients will actually come to our hospital, but they're not admitted in the hospital. They're just seen for their appointments right outside the facility. And that's a pretty common thing to do. With an outpatient appointment, the type of things you might expect could be maybe in pediatrics. We have a lot of our pediatric dietitians doing counseling with patients and their parents. You've got a lot of kiddos with food allergies that really just need some help and guidance to make sure that they are still healthy and growing and staying strong, despite maybe having to avoid a lot of the major food groups. Another example of the outpatient piece would be your chronic diseases. So for instance, I got to go when I was a kid with my dad. He got prediabetes and needed some nutrition counseling. That's the first time I learned what a dietitian was. And so we went and saw a dietitian. He learned how to count carbohydrates, how to eat an appropriate diet for someone with prediabetes. And thankfully, learning that at that time had a huge implication on the health for his life. He's doing great now, and thankfully his disease did not progress from there. So that would be more of what we consider outpatient counseling. Those patients can walk and talk. They're coming in and getting some amount of education to take home with them, which is very different from our people coming into the hospital that are really very sick.
That's great information too. And it is fascinating to me in the hospital, the difference that a dietitian can make, because what you mentioned was we want our patients to be able to walk out of the hospital and not lose all that muscle mass. And the research has continued to really grow and blossom in that area on how to keep people functional while they're kind of out of it or in a hospital bed. So that's spectacular. I do think most people are more familiar with the outpatient scenario, but I'm glad to hear your dad did well and listened to his dietitian.
Right.
Last question, Deanna. What else would you really like people to know about dietitians, or how a dietitian can help solve a nutrition problem or need?
Yeah, definitely. So, I think now that people are learning more about what we do, a big question is, do I need to see a dietitian, and how would I do that? So I'd really love people to think about, as you're thinking about your health throughout your lifetime, and, most of us have appointments with our primary care physician for something here or there. Occasionally, it's going to need to be you that advocates to be able to see a dietitian. It may not be one of the first things that your provider thinks about, or maybe it's a part of your care plan where you have some medications you need to take. It's recommended that you exercise, and also they recommend that you see a dietitian. But sometimes just as simple as asking your physician, do you think I should see a dietitian about my diabetes, or do you think I should see a dietitian about my weight? Can really help initiate that conversation and start to be thinking about, where does nutrition play a role in managing a disease or managing your health. So from there, your physician can send a referral. So we receive referrals here at our facility for all kinds of things. That allows us to prepare for your appointment, allows your insurance to be billed for that appointment, depending on what it is. It may be covered, or maybe it wouldn't, just depending on the service that's provided. And that's something that you and your physician and your insurance could kind of work through in preparing for your visit with the dietitian. Some other really cool things that we're starting to get rolling out is telehealth. So dietitians are becoming more and more available, where, a lot of counseling could be done over the web, talking about a meal plan, potentially talking about some of your health related goals, evaluating labs. We can receive labs electronically, and then we can do a lot of assessment and counseling just over the web. So we're rolling out telehealth. Dietitians all over the country are starting to do this type of counseling services electronically. And so consider that as one potential option, especially if you live farther away from a larger city that has a lot of dietitians. we still may be able to do that counseling with you just right in your living room.
Awesome. That's great. So I love that piece that you said about advocate for yourself at the doctor's office. Doctors are super busy and they do a great job, but sometimes they don't remember to refer or don't think about it. So always ask, can I see a dietitian? Can you refer me to a dietitian? I think that's great information, because even as patients, I've gone to the doctor and I'm a healthcare provider, and I still sometimes go with this blank, glazed over look on my face. Like, I know I was going to ask them something. What was it? So take a list with yourself and remind yourself to ask. When they say go exercise, we might go join a gym. But what about when they say improve your diet, right? So that's the cue to go see a dietitian or at least ask about it.
Absolutely.
So thank you, Deanna, so much for taking time out of your day. I know you're busy because we all heard those pings coming in. So we appreciate your time.
Absolutely. It's been a pleasure, Kim.
Bye.